Hello, everyone. On behalf of the Spina Bifida Association staff, welcome to SBA's Ask the Expert session, Self-Management in Children and Adults with Spina Bifida. My name is Judy Thibodeau, a member of SBA staff, and I and my colleague, Gianna Spear, will be with you for tonight's presentation. Before we begin, a few housekeeping notes. If you have a question or comment, please feel free to use the Q&A feature at any time, and we will try to get to as many questions as possible. You may use the chat function to communicate, which we will not be monitoring as closely. You will receive the recording of this presentation and an evaluation summary survey. Please take a minute to complete the survey so that we will learn what topics are important to you for sessions like this in the future. Lastly, today's event is being recorded and we will post the video to our website soon. Our speakers tonight are Julia Bellarose, Boston Children's Hospital, and an adult with spina bifida, Shannon Bevins, Adult Transition Coordinator at the Spina Bifida Clinic at Orlando Health, Arnold Palmer Hospital for Children, and Dr. Andy Zabel, Kennedy Krieger Institute, Neuropsychology, and a member of SBA's Professional Advisory Council. So I think Julia is going to talk about our questions that have been submitted when you registered, and we'll take it from there.
Sure. Hi, everybody. So what I'd like to do this evening is to read the questions word for word that you have all submitted, and my colleagues and I would be happy to answer any of these questions as best we can. And if there's any way that you'd like us to answer them differently, as Judy said, feel free to use the Q&A feature to sort of jump in. And as soon as we can, we'll get to be able to sort of clarify anything that needs to be. So if everybody feels ready, I think I can read the first question, if that's okay. So the first question reads, how can we help our 9-year-old son play a larger role in the ownership of his bowel management process? This is an area that keeps him from being fully able to separate himself from our care for field trips, sleepovers, etc. So is there somebody who'd like to touch on that first?
So I'll go ahead and jump in. I think that one of the ways to get a 9-year-old to play a larger role in the bowel management process is to, first of all, you have to start in steps. You have to set goals and you have to kind of work in steps. You're not gonna be able to do all of it all at once. But I find that in our clinic, if we can just say, hey, if we can get the family to start doing it piece by piece. So maybe they might start the timer themselves. And then maybe they might do that for the first week. And then the second week they start doing the setup. And then, so really just making sure that you have like a schedule, but you also have goals that you set both as, as a family, but doing it kind of over a period of time, because I think it might be a little bit overwhelming for people to try and get them to do it all at once. I don't know what you guys think.
Yeah, well, I mean, this is such a good question, because in some ways, if the 9-year-old's not doing a great job managing their bowel program, you could have an accident at, let's say, a sleepover or something like that, and that's not necessarily what you want. So in some ways, the bowel problem can keep people from going on that sleepover or the field trip. On the other hand, if kids go on field trips and sleepovers, they become very, very motivated and can become motivations for, doing the self-management process as well. It's like, oh, if I do this, then I get to go. So it kind of cuts both ways. I don't think we want to let the child, miss a lot of opportunities for those socialization opportunities. And the more that they can get out there and do those things, the more I think they could be motivation for doing the self-management. In this case, we kind of have two things. It's like the motivation, but it's also the, when are you going to get it done, and kind of the planning and organization. So, motivation's one of those things, but organizing a way that they could still go on the field trip or go on the sleepover, I think is really important because it starts to reinforce the self-management. But Julia, we were talking earlier, you had kind of an idea of what you could do maybe, in the event of like a sleepover or something like that. Do you mind sharing that idea?
Sure. So I think it's really important to sort of give, within reason, as much control to kids or young adults with spina bifida as you can in these processes. And I do believe that if you say, okay, you have soccer practice at 7 o'clock, but your bowel management's non-negotiable, you have to do it at some point, the child can then choose, okay, I'm going to do it at 3 o'clock. And if it's a younger child sort of starting to help manage the routine, you can sort of let them choose, okay, do you want to fill the water? Do you want to put the additives in? Whatever it is, it may be that would help them, feel like they're part of the process. That might be a really good way to sort of get them going and get them motivated to sort of start the process and not feel so isolated about having to do it if they still get to do the activity that they wanted to begin with. So I think we might be ready to move on to the second question, which is, my 5-year-old is in diapers. What are the next steps to encourage self-management?
Who wants to take this one?
I can sort of jump in first, if that's okay. So I think this can go in a lot of different directions. I think first, it might be good to say that some of these questions we'll definitely try to answer in as in-depth as possible, but for some of these topics, you might need to speak to your medical team about parts of what's going on, just because we're not sure about the specifics of any certain child. So we just wouldn't want to give advice based on something that we aren't quite sure. So, but what I'm sort of hearing from this one, what are the next steps to encourage self-management? And I think that might kind of depend on sort of where you plan to end up with it. So if the goal is for them to be completely continent within the limitations of that sort of thing, and they want, a surgery for bowel and bladder to sort of control that, that might be good. But if they're not ready for a surgery, or they just don't want a surgery and you feel that that's not right for your family or your family dynamic, whatever it may be at the time, that's okay too. There are a lot of other options, such as, medications and things like that can sort of help move those things along. But again, it's sort of specific to each person, and you sort of need to be able to figure out what your goals are for the management to be able to sort of initiate that task.
And I agree. And making sure that you get the medical piece addressed first and foremost, but after that, also, what are the motivators? Like, what are they motivated? What, do they have a play group that they want to go to? Do they have other kids that they want to play with? And I mean, you can kind of use that as a carrot, if you will, to try to get them to do more things on their own if they have a motivation, if they have something that they really want to do, that can help.
Yeah, I think that's a really good answer. And I'm going to go back to something Julia said for the first comment, that, I think the next step for anyone in this kind of journey is to have, a responsibility given to them. And I think one of the principles here of, someone learning how to do a bowel program or a catheterization program, it's not an all or nothing prospect. It really kind of, it starts with the parent, it ends with the individual, and there's a lot of overlap in the middle. And so, at the beginning, the parent's doing most of it, but some things can be given over. And one of the things we were talking about earlier is like, even just like learning some of the steps of catheterization, like, let's get out the equipment and lay it out, or let's, wash our hands now, or let's start the steps, because those steps are going to be key. And as the individual shows a capacity to do the smaller things, then you can start moving up to the more and more responsibilities with parental monitoring instead of just, the parent doing all of it. But I think we all agree that it's a process, and it starts with handing over small responsibilities and then moving forward. Again, with all of the knowledge, and input from your medical team on, what's appropriate and what's the right way to do it. You
Sure.
want to move on to the third one?
Sure. My son has frequent urination with poor bladder evacuation capacity. Please help. I think for this one, it may be a good first step, again, to just speak with your medical team about sort of what you're working with at this point, just to be sure that there's not any underlying thing that might, that if it's not their baseline, you feel that may be causing something like this, or if it is, then sort of maybe speak with them about what kind of things are available to manage it. But that's sort of, it's very specific case by case basis.
I would agree with that.
I almost think that's the answer to the fourth one too, isn't it, Julia? Like, you're still wanting to check in with your medical team to really
Right.
talk through what are the various options.
I think that's sort of where we'd be going with the third and fourth question.
Yeah.
Yeah, same thing with is surgery. It certainly isn't the only option at all that exists, but certainly you want to talk to your medical team to see if that's appropriate for each individual case. All right.
All right.
Okay. How young have you seen or heard of children being able to self-cath?
So
I think for this, oh, sorry, Shannon, go ahead.
nope, you go. You go.
Are we going to give an age on this one, guys?
I think we've sort of kind of spoken about the fact that that's very individualized to the child, but it is great to sort of start them with little steps as young as possible. So if you think about with someone, a toddler who's 2 or 3, we could say, okay, it's time to cath, wash your hands, and mom and dad will take out, whatever it is that needs to be taken out and sterile, until they're sort of old enough to realize, okay, I need to wash my hands, but they need to stay clean throughout the entire process while I'm doing everything. So that may impact what a child is ready for at any developmental stage.
Yeah, and
Oh, go ahead, Shannon. I'm sorry. Yeah.
I think if you can get them independent once they're in school, that's helpful. As I know it's not doable for everybody, but the earlier the better. And once they're in full-time school, if they're able to do, makes things a lot easier, I find.
Do you guys know of kids that are cathing in kindergarten, like on their own?
I have only experienced with children who are like in full day, and I don't think kindergarten is full day. So I don't think I don't think I've had an experience with kindergarten, just first grade, I think.
Yeah, I think that might be a little bit young, but I'm not completely sure.
Yeah, I've known some people, I think by first or second grade, that were cathing at school, in the nurse office. But I think this question kind of gets to this idea of like, what does it mean to be able to self-cath, right? So like, does that mean you don't need any reminders at all or any monitoring? And it becomes a little tricky. So I would continue to kind of push this idea that it's a gradual transfer between the parent and, in this case, the child, taking on more and more responsibilities. And, may need ongoing monitoring from a parent, but, maybe learns the individual steps and gradually kind of takes that over. So it's not an all or nothing proposition. I think it's a gradual transfer. So it would be hard to pin an age on it, but I can tell you that I think you can start assigning individual tasks very early. I would say as early as 2 or 3, you can start asking kids to wash their hands and arrange the materials, and, then they can continue to learn steps as they move along.
Agreed.
What are the logistics of bowel movements and urinary control in adults with spina bifida? I think for this, it might be important to first decide how you want to manage your bowel bladder things. There may be, a requirement that you need to self-cath, which is totally fine. But there are lots of different options I know for at least bowel management, and even with cathing, I know that there's the Mitrofanoff surgery. There's different things that can take place. So I think it just depends on what you feel you need to do for you and your family to be able to have it on a regimen that's best for you, that will keep an even pace for what you need.
And I don't know if this really speaks to it, but from the medical side of things, but if you are talking about like the logistics of bowel and bladder control when you're like in employment, or when you're in college, or when you're living on your own, that would be when we would speak to like asking for accommodations and making sure that you're communicating with your employer or whoever, whoever you're living with, what it is that you need.
Yeah.
And how to manage that socially.
As a neuropsychologist, I look at that question, and I see organization written all over that question, because to really manage but to obtain urinary control and, really good bowel continence, it takes a lot of preparation, I think, and I think it takes a lot of organization. In the school, I know a lot of kids learn to really coordinate their cathing around regular things that happen. I cath when I get up. I cath after the second period. I cath right after lunch. I cath once I get home from school, and I cath before I go to bed, or something like that. But that is harder to do on the weekends, right? Because you don't have those naturally occurring reminders. And that's where that's why I say it's all about, it's, in my mind, it's a lot about organization, because you may need, it may work really good on the weekends, but I know a lot of, youngsters that, struggled on the weekends because they didn't have those cues or reminders. And that's where you may have to put in like okay, we're going to set some alarms on your phone so that you remember to do that. Or we almost need a sign by the door before we go out to do something, to make sure to pack a bag and bring all of our necessary materials with us, so we don't have to come home early, or we don't have to interrupt what we're doing. So I think it's a lot of organization. Do you guys have any other thoughts?
I think that pretty well covers it. If Shannon doesn't have any other thoughts, we might be able to move on to the next one. Sure. So how can I help my son with self-care and bowel control? I think this may really go ahead, Shannon. Sorry.
No, I was just going to say, it also again speaks to motivation and sort of what is the interest. If there's an interest outside of, the house, if they are interested in, participating in a sport, or, whatever it might be, then you can kind of use that as motivation to try to get involved with doing their own bowel and bladder control. I know that sometimes, when you're working, you have to be able to manage your hygiene if you're going to have employment, right? You can't have poor hygiene when you're working. So what are the motivators? Are they people? Are they goals? Is it employment? Is it post-secondary? Is it college? What's the motivator?
Yeah, I entirely agree, and I think there's a lot of ways to answer this, right? Based on, what kind of help do they need? I agree with Shannon, like that, if they need motivation, you know, outside activities can be a great motivator. Like you're going to participate in this, so you need to make sure, but you can provide organizational support too, right? If they need like, okay, let's really come up with a plan for the weekend so you don't forget to do your capping. Or it may be that they, are struggling to even, learn how to do the skills. So there's different ways that you can help. But I think organization and, the motivational things that Shannon talked about are really important.
I think also too, at the very beginning, before a child is ready to sort of begin to take on these tasks, even partially by themselves, it's really important for the parent and the child to work together as much as they can to get on the same page about the way these things are communicated about. Because eventually, when the child's an adult, and it's no fault of anybody's, but if cues are being missed about how communication is being handled, and one thing leads to another, and they're missing steps because they're not understanding sort of how you're communicating or what you're trying to communicate, that might lead to a problem that leads to more frustration on both ends, that just gets really burdening because you don't know where it's coming from at that point.
Yeah.
So the next one is, I struggle with dating, particularly of whether or not to share upfront, initial phase of talking on the phone, getting better acquainted, about my spina bifida diagnosis before we meet in person. What is the best approach to handle this?
So I can go
Shannon,
first on this one.
Yeah, go ahead.
Part of this will just be like self-disclosure, right? As a person with a disability and with spina bifida, and working with patients and young adults who do this. So it's very individual. It's up to the person, how much you want to disclose, or if at all. I think that, at least for me, I'm only speaking for me here, but you want to address the elephant in the room. Like, I use a wheelchair and I walk funny. That's going to be clear whenever you meet me, right? It's clear that I'm different. So I'm upfront about that usually. But the more personal stuff, like the cathing and bowel management, all that, might want to hold off on that, unless you get to be a little bit more personal. But it's very individual, and I have had people be on dating apps and share their whole life story, and I've also had people until they have had a few dates with somebody. So I think it's really individual, but for me personally, I mean, I just address what is visible initially, and then as it progresses, I can share more, but that's just me.
I think my stance is sort of very similar to Shannon, just because I too am sort of the mindset of, let's address what's very clear. My gait's going to be off. You're going to notice that as soon as you meet me. So we might as well say, okay, I have spina bifida. I walk with braces and a crutch. But as Shannon said, I may not go right into, and here are my bowel and bladder needs and things like that, sort of until you build up that rapport with somebody over a period of time before you're comfortable enough doing that. So I agree with what Shannon said. So the next question is, one area with which I struggle is dating and intimacy in a relationship. When is it okay to bring up that I was born with spina bifida in the initial phase of conversation when we are getting to know each other better? Shannon, do you want to take this one
Again, I
first?
just think it's a personal preference, and there's no right or wrong way to do it. I mean, you just have to do what you're comfortable with. I mean, it doesn't matter if you're in a friendship or a relationship, but I think, I would hope at least, the initial meeting that you have with a person, you would know whether or not you feel like you want to continue with that person. And I don't think that there is one right way or when to, but I think you just kind of have to gauge the situation, gauge the person, and you might share a little bit about yourself and then see what their response is. And if it's like deer in the headlights, freak out, then okay, well that's probably, you should probably stop that now. Or to just keep going. If the person like keeps asking questions, isn't genuinely interested, then okay, like keep asking and I will answer. But I think you have to gauge the situation personally.
Yeah,
I think that was a great answer.
yeah, I really like that answer too. And I mean, I think that, you control information about you, and, maybe some of it you can't hide on the outside, but, I think you should trust someone before, you trust someone with the information if you want to share that, or at least have the opportunity to develop trust. So that's for a lot of different things in self-revelation. All right.
And intimacy is,
Go ahead.
I'm sorry, intimacy is a hard one, I think, whether or not you have spina bifida or not. But yeah, there are certain things that are specific to people with spina bifida in that realm. And if you're going to be intimate with a person, then you have to decide for yourself, okay, well, how much information am I going to give somebody before that happens, right?
Yeah.
Good.
So the next question is, are there group get-togethers for mothers and their children with spina bifida? I think the
So I
short answer
know-
is yes.
Yeah, the answer is yes.
Yes.
The National
Do we-
There are
Resource Center is
different ways to find
amazing.
them.
What were you going to say, Julia?
Where would we find them? Are they on the Spina Bifida
Oh, I was just going to say
webpage, or?
yeah, there can be different ways to find them, like your local chapter, if you have one of your Spina Bifida Association. A lot of times they have resources, or National has a lot of resources as well. But there definitely are. Shannon, did you have anything you wanted to add?
Yeah, I was going to say that's why chapters, find your local chapter, closest chapter to you. Hopefully they have support groups, but National Resource Center is your go-to place for that.
Okay, so the next one is, are there apps to help with self-management? And if someone isn't comfortable with technology, what other options do you suggest?
I love apps. And I love timers, and I love kinds of things like that. But I've over the years, I've really learned from people that people have different levels of comfort with technology. Some like high tech, and some people like low tech. It really, I've given people app suggestions, and it's failed miserably. They didn't like it at all. And sometimes I give them an app, and it's like, yeah, that's the best. But I think it entirely comes down to personal fit of, what's the best way for you to organize yourself and to remind yourself. And that's not always an app. Sometimes it's a low tech device. What do you guys?
I agree with that. I think it's important to decide what works best for you. And as you said, sometimes that's old-fashioned pen and paper, writing out checklists, and that's totally fine. You just have to know what works best for your brain.
Yeah,
I
some
would
people
agree.
really like lists. Some people really like just having a list for the day, and they take so much pleasure in just crossing things off across the course of the day. I'm not one of those people, but they may be low tech,
And see, I am. I'm an adult with spina bifida, and you should see this off. Like I have lists everywhere, and I am obsessed with crossing them off. And so, but you just have to find what works for you. And I like different colors, so I have different
Oh,
color stickies.
the lists are different colors?
Yeah, so, and everything's a different color, and what I learned from you, Andy, is, to make sure that you're color coded and all that good stuff. So, but
Yeah,
you have to find what works best for you, and if you're a tech person, great. If not, it's never bad to just use good old pen and paper.
yeah.
Okay.
Somebody,
So
someone
then,
in the chat has mentioned that before smartphones, they used a day timer. So if a day timer works for you and it still works for you, don't let people talk you out of it just because there's fancier apps. Use the organizational approach that works for
sure.
you. Sorry, Julia, go ahead.
Oh, no, that's okay. I was just going to say, do what works for you. And that's different for everybody. So don't feel bad if one person uses a pen and paper and you like your apps. That's totally okay. The next question is, are there any support groups for walking adults with a tethered spinal cord?
We talked about this, and I don't know of any specific support groups specifically for walking adults with tethered spinal cord. But when I get this question by some people who might feel like they don't want to go to a support group that is like for people who are primarily wheelchair users, I will say, well, then maybe join a gym or try an activity that you enjoy doing, like an adaptive sport, for example. So it doesn't necessarily have to be a person specifically who has spina bifida, but maybe a person who has something similar, a similar condition, I think a lot of it has to do with like shared experiences and how you present yourself in the world. And so it doesn't necessarily have to be somebody specifically with spina bifida. So oftentimes I'll just encourage folks to, again, join a gym or try an adaptive sport, something that is similar to how they present in the world, and to deal with the problems that exist for that individual person might be, different than a wheelchair user.
I think that makes a lot of sense. I think that's a great answer.
Oh, such a great thing. Yeah.
Okay, so the next set of questions pertain to learning. Are there suggested teaching methods and tools for individuals with spina bifida who also have intellectual disability? I think that goes into a lot
You
of
guys, I'm a
what.
neuropsychologist.
Oh, sorry, Andy. I
Sorry.
think you're a bit frozen. I'm not sure if you're
I'm-
talking or not.
Oh.
Oh,
Yeah.
we might have temporarily lost him. That's okay. Did you want to touch on this for a minute, Shannon, or did you want me to? Or
I think that to have, our neuropsychologist is a great person to answer questions about specific teaching tools. But I do think that relying on occupational therapy, at least that's what we do, is occupational therapists have incredible ways to teach methods and have different like tools on how to, motivate and teach a person who has spina bifida who also has an intellectual disability. So if you can speak to an occupational therapist, or child life specialists are really good too. Yeah, that would be my recommendation on that one. I don't know about you, Julia.
yeah, I think it's funny. I did not at first think of a child life specialist, but I think that's a really good place to start. And I also think that if it works for you and your family, it is always an option to go to a neuropsychologist and sort of have them give your child an evaluation to sort of see where they're at in terms of intellectual disability or anything like that. And then from there, sort of, they're able to make suggestions about what can be done for those types of needs that a child has, and also write a report to be able to walk you through sort of what happens next steps once you get that that may be good for your child moving forward, to be able to accomplish certain things.
You guys, thank you for talking about neuropsychology while I was glitching. I think it is really helpful. It depends on, teaching methods and tools. If we're talking about self-management, I think neuropsychologists can help with that. If we're talking about school, I think, a neuropsychologist can help with that too, and knowing, the issues, but also the strengths and capabilities of the individual can really help in planning, an adaptive way to meet the self-management demands. Even if someone has intellectual disability, I think there's a lot of things that you can, people with spina bifida can do and can learn. But the nice thing about neuropsychology is it gives you a nice individualized learning approach. So I agree with what's been said.
So the next question is, how is a child's self-management affected by Chiari malformation? And also, how does Chiari affect speech?
I think this one is one that you probably want to take back to your medical team. I've seen people that have had speech impacted by a Chiari malformation, that resulted in word finding problems. Obviously, you can have, symptoms of a Chiari malformation. You can have pain. You can have, other symptoms. So I think it impacts people differently. So for this one, I think the three of us kind of agree. You may want to take this kind of question back to your medical team to find out how does your Chiari malformation impact you and your self-management, and what can you do to kind of get around that if it's a barrier? Do you guys have other things about Chiari's? Yeah.
And I don't know, maybe a suggestion for the right providers to talk to. I don't know, neurosurgery would be a person who I would say would probably be a good person to start with. Neuropsychology, those might be good people that you'd want to reach out to.
Yeah.
Yes, I think those are all good suggestions. Okay, so here we're talking about resistance to self-management. The first question is, as a parent, how can you manage your child's resistance to or rebellion against self-management?
What do you guys think?
So I have seen this where you get into this whole kind of power struggle of parent really wants the child to do it, but because the parent is saying you have to do it, then they rebel and say, well, I'm not going to do it now. You told me to do it. And then it just becomes this like constant kind of loop of parent nagging child to do it and then them not doing it, and just it doesn't really work. So what we try and do is try to introduce maybe somebody else into the equation. So is that a person that they respect? Is that, a friend, or maybe a peer mentor? Like, I mean, if you have a person, if they have a person that might be a peer, or, somebody that they look up to, that can sometimes help the child say, hey, look, maybe you want to be more independent, or, getting them to do a sport. I was just thinking about this. A lot of times we'll see a kid want to take more of a role in their self-management if they join like a team sport, because if you're like on a basketball team, you have certain things that you have to take care of. And part of that is making sure that you have good hygiene. But again, they have peers, they have other people that they're surrounded by who also have to do those things. And they might think, oh, well, I want to be like so-and-so. So my suggestion would be to try to introduce another person or a mentor or something kind of into that equation.
I think that's a really great perspective to have an outside source sort of help with that sort of motivation piece to be able to get things going from a self-management perspective, especially because, as Shannon was saying, the power dynamic of sort of a parent really wanting their child to be successful and be able to engage in all of these routines may be really difficult and tiring to both the parent and the adult or child with spina bifida to some extent. You know, eventually, if the same thing keeps happening over and over, I can only imagine how frustrating, you know, that is for people, and it may just lead to almost a burnout effect. So it may be really important to introduce that third party that can be the one to sort of have a break in that dynamic, just even for a few days, a few hours, just to give a fresh perspective to the other person with spina bifida to be able to go back to the other caregiver or adult and look at them with fresh eyes and be able to say, you know, this is what I took from that, and we can move forward.
Yeah. Yeah. I mean, parenting in general is challenging, and getting kids to do what's right, good for them, um, can be challenging. And I've talked with a lot of families of individuals with spina bifida, and this, is sometimes an issue where it's, um, uh, you can get into like a pattern of conflict around these things. And sometimes getting somebody else involved and letting somebody else kind of be the coach or mentor, of self-management, can take a lot of pressure off of you as a parent. So I think Shannon kind of stated that, but I think it's worth, mentioning again. I think getting other people involved and not putting all of it on yourself is probably a good.
Sure. So the next question is, I'm a mother of a 30-year-old female. I'm struggling with getting her motivated to take care of her teeth by brushing and flossing. She lives independently and works with children. I try to tell her she is a role model for the kids she helps.
Yeah. I don't like brushing my teeth either. What do you think, Shannon? Do you have advice here?
No, I mean, I don't like it either, but have to do it. You know, it goes back to what I said earlier. What is the motivator? Does she have something that she looks forward to? Introducing, like, is there another person in her life that can suggest that she take better care of her teeth? Maybe there's somebody that she admires that might have nice teeth, that she might, be inspired by. So again, it's I don't know how helpful it is as the parent to just keep saying it over and over and over again, because that's not gonna work. So you have to bring something else into the dynamic, and you have to find kind of where's the motivation, or if there's not any motivation, where can we create some? What is she interested in? Just kind of, interrupting the dynamic, and what motivates her? Is there anything that motivates her? I don't know.
Yeah, at 30 it's hard. It's hard too, because when I was 30, there were a lot of things that my parents wanted me to do that I didn't do. And lifestyle change is hard. Like if some people want to exercise, right? Or some people, or need to exercise more. Some people want to lose weight, or some people want to quit drinking, whatever it is. Lifestyle changes can be difficult. And there are different ways to do that. But think about that, like how, what would you have to do to if you're not exercising, what does it take to start doing an exercise program? It takes a commitment, and it takes support, and it takes encouragement, and it takes almost a community of accountability sometimes. And I don't know how you set that up in this particular situation, but I would encourage whoever asks this to think about it. This is a lifestyle, change that might be hard.
Yes. I think also in certain ways, a lot of spina bifida encompasses self-care, which can be very hard when it comes to, okay, here are the things you need to do for self-care. And, you will get reminders, and that gets frustrating because sometimes we think that that's a strictly spina bifida issue. We're getting reminders because we have spina bifida and we have these issues that we struggle with, when in reality, mom might tell, little sister also to brush her teeth 30 times a day and, get the same response. So I think it's just an interesting dynamic when it comes to the role models around the person that you're seeing also having to take care of themselves. But you may not feel the same way about your self-care as they do because it's harped on so much, because of the detriments that it can cause, if it's not done properly and routinely. I think that's also very important to consider, that sometimes, although necessary, it is just very draining, and that may play a factor in it as well.
And going
Yeah,
off of that, what Andy always tells, we as people with spina bifida, we have a lot more things that we have to do on a daily basis, period, right? Well, flossing and taking care of your teeth, brushing your teeth, that's something that everybody should be doing. But on top of that, now people with spina bifida, like, we have other stuff that we also have to deal with. So to just understand that, like, it might be coming from a place of, well, you are asking me to do all of these bazillion of other things that I'm overwhelmed with doing, and I don't have any strategy on how to attack those. So I'm just going to shut down and not participate in brushing my teeth. I mean, I don't know if that's the case, but, like, just speaking to, like, the mental load of that.
Yeah. Well, and there are, like, I agree 100% that, people with spina bifida have to do so much more and have so many more self-care responsibilities. It's a lot to put on someone. And I do think you want to think about it as a parent of a 30-year-old. Like, if your adult child is not cathing, then you probably need to say something and do something, because that's life-threatening. But if your adult child's not brushing their teeth, I don't know, I might say just leave them alone. Is that a bad answer? My dad's not a dentist, so maybe I can get away with that. I don't know. That's my advice. Leave them alone.
Yeah. Okay.
Okay, so the next topic is learning self-management as an adult. So the first piece is, what options are available for a 52-year-old with spina bifida to live on her own when she never has before?
So I can take a stab at that one. What options are available for a 52-year-old with spina bifida to live on her own? Well, I think you have to define, like, how independent do you want to be? Do you want to live completely independently, or do you want to be in a supported living environment? Can you live on your own and have a caregiver come in with you to, help you with certain tasks throughout the day? So I think the first step would be to define how independent that you want to be. And then really leaning on your local supports, like your centers for independent living or disability resource offices that are local to you. What options might be available? Is Is there independent living? Is there assisted living? If you can get an accessible apartment, but you can maybe get services on having someone come in to your home, maybe 2 hours a day or something. So there are a number of ways that you could structure that, I would think.
Yeah.
I agree.
I think, yeah, oh, I'm sorry, Julia. Do you have anything else you
Oh
want to
no, I was just
Okay.
barely going to agree with Shannon.
Well, I mean, we all agree with Shannon. She always says such good things. But the thing I think a 52-year-old moving out, an 18-year-old moving out, I think you really want to gauge what is the level of support that the person needs, right? Because it's not going to be one size fits all. And you can use the current living situation as a laboratory to figure out what that is. So what if you as the caregiver did not give any prompts or reminders or do any particular tasks for that person? If you step back and you can probably get kind of a sense of what level of support they do need. Oh, they don't need reminders in the morning. They don't need help getting out of bed, but they do need, help with grocery acquisition, once a week. Or maybe they need someone to help them do their bills, once a week, but they're really good at using an ATM card the rest of the week or something like that. So, I don't know the specific, I think Shannon kind of mentioned a lot of really good options, but, you want the level of care and support to match the needs of the individual. So you want to have a good sense of that. There's a couple of people in the chat. Am I frozen up? Oh, okay.
No.
You're good.
I thought I was. There's a couple of people in the chat, and the both of you have mentioned how great OTs are. And I would say like an OT assessment, to really get an idea of what this person needs, and what level of support they need would be a really good idea in this situation.
Yeah, and then I know I said this in the last presentation, but the Centers for Independent Living, those are really, really good resources. And most every place I know of at least has a Center for Independent Living that's relatively close to them. So I would say if you want to start doing that, like to reach out to your local Center for Independent Living, it would be a really good resource.
Okay, are we ready to move on to the next question? Okay,
Yeah.
How can I manage my health? I'm having health issues other than spina bifida. It's been really hard to find a doctor who knows what to do. I think in some sort of way, unfortunately, there are definitely resources and referrals that can be made. And again, it's best to go to your medical team to discuss your specific issues. But I think we're in sort of the time period where we're still sort of learning and developing resources for adults with spina bifida. And that's very ongoing and, is happening, but it may not, cater to a specific need as quickly as you might need it to, unfortunately. So I think maybe the best thing to do is go to your healthcare provider and maybe they can suggest if they have a solution or if they can suggest another physician who might be able to speak to you and decide what a better course of action would be, then that might work well.
And I can't just speak, I've said it before and I'll say it again, but I cannot stress the importance of having a good primary care physician. You don't necessarily have to find a PCP who knows everything about spina bifida. I don't know if I'm sure they exist, but you want to just have a primary care physician who will listen to you, who will answer your questions, who will be a partner with you. So I could not, on this one, I could not stress enough trying to find a good primary care physician.
Is that common to have a PCP and a spina bifida care team? Like, should you have both?
Ideally, You would want to have a PCP after that they're kind of the main driver. But again, you want to find a PCP that you're comfortable with, which is up to each person, and that varies. But at least that's what we encourage, is especially after they age out of our clinic, is to find a primary care physician that they're comfortable with.
I see in the chat here, Judy Thibodeau has mentioned, reach out to the National Resource Center, SBA. So
Yes.
it sounds like
Yes.
that's a good option as well.
Okay, so the next question is, what problems can we expect as we age, and what resources do you suggest? So this might be a person-to-person basis about regarding sort of what problems you might, face as you get older, just because some may be specific to spina bifida, others might not. So that from my perspective is a bit difficult to answer, but the resources could be anything from, PCPs to anything that might assist with, therapies, or, anything that might cater to the specific issue that you're having. I'm not sure if there's anything you wanted to add to that, Shannon, or.
Well, I'll just put another plug in to consult the healthcare guidelines.
Yeah, that's a good idea.
Because they do. I mean, it is helpful. So that's a really good resource.
As a neuropsychologist, I can say that, we were at one point worried about the idea of premature cognitive aging in spina bifida, right? And to this point, there hasn't been a lot of evidence of that. So, as you age, I think in some ways you want to think about the things that everybody, thinks about aging. And there may be some specific things about aging with spina bifida, but I think Shannon's right on it there. Like the healthcare guidelines are going to give you things that you want to think about doing. And the if you haven't looked at them, the Spina Bifida Association, I think paid to actually make the guidelines available to everyone, even though they were published in a journal. So I'm sure that Judy or someone else can direct you to those. Can I just say, I noticed in the chat, I saw somebody talked about feeling overwhelmed and what kind of helps them stay motivated. I thought it was a really cool comment. This particular person uses the TASK app, TASKS app, I think, to remind them to do things. Do you know that one, Shannon? Tasks. I don't know that one, but someone likes that. But the other thing that this person says is to surround yourself with friends that are good at what you're terrible at. And I say amen to that, because nobody's good at everything. And, surrounding yourself with people that know things that you don't or can do things that you don't is a really good way of creating a circle of support around yourself. And that's really critical for everyone as they move into, as they age, but even as they transition into adulthood.
And I'm sorry, I'm not seeing the question, so I missed that. I apologize. What was the question?
Oh, I don't know that there was a question. I was saying that there's a task.
Okay.
Do you know the TASK app?
Tab. Oh, tab. Like in tab at. No, I don't.
TASK, TASKN. One of our listeners recommends that, so you may want to check that out. Not you, Shannon, but the audience. I know you like desk calendars.
I know we're almost out of time, but we have 2 questions I'd love to propose. And I want to note that there is an occupational therapist and a nurse practitioner from urology in the participant group. So if you have information to add when you hear these questions, please do so. The
Yeah.
first is how to minimize urinary accidents in between cath schedule. And it doesn't sound like it's missing the cath schedule. It's like I'm doing the caths and I'm still incontinent or having accidents. And Gianna, I don't know if any of the participants can answer or not in this situation.
Everyone's able to add stuff into the chat.
Okay, okay.
It does look like Gianna put the link to the guidelines in the chat. So I would really encourage you to like look at that document because it's a lot of hard work and it's great information. Was there a second question, Judy?
Yes, the second question is harder than the first question.
Oh no.
Vertical
I was hoping
callus.
it would be easier.
What is your take on casting and minor surgical intervention after the age of 2 in a person who has vertical callus?
I don't.
Anybody in the
I'm
audience?
not even sure what that is, so I'm not going to
Me too.
Yeah, I'm
That's
not
right.
sure.
So let me say that we will take these questions to heart and do our best to provide some input from people who know, at least are familiar with the topic. And I will say to the person with urinary incontinence in between caths, it's, you have to go back to your urinary management team. And anyway, that's not a very satisfying answer, but that's what we know is probably what has to happen.
Judy, I can answer if it's okay. I wasn't sure. Sorry. My name is Abby. I'm coming from Sick Kids in Urology. I'm the nurse practitioner.
Thank you. Yes, please answer.
I was going to mention the same thing, is that managing incontinence is going to be pretty tough. There's a lot of different factors that can be a reason for incontinence. One, if you're on a very sort of relaxed catheter schedule, you could try increasing up the catheter schedule. A very strict catheter regimen would be every 2 hours. It is not easy being on an every 2-hour catheter schedule, but if it reduces maybe the use of medications and it works in someone's lifestyle, it's all based on your quality of life. If that's something that you can manage and you would rather increase a catheter schedule than add medication, we allow a lot of the adolescent population particularly to be able to make those decisions on their own. Additionally, you might need some urodynamic testing to be able to see, is there a change in the dynamics of the bladder? The bladder is an organ that changes over time, and definitely, it's not something that will remain if you do have a very compliant bladder or a bladder that doesn't have any hostility to it. Doesn't mean that it's not going to develop hostility. So just in and of itself, with changing, where suddenly you're starting to have leaking or you're having infections, any kind of change like that could suggest that maybe there is a need to reach back out to urology to see if there is something that's happened. Is there a tethered cord that's creating the incontinence now? Maybe the need of medications is something that needs to happen, or even introduction of Botox injections, which is another option for patients who don't have the ability to tolerate oral medication. And then the one thing that I think a lot of patients forget about is the bowel lives in the same area as the bladder, and most of the patients do have an affected bowel, and you might see a lot of constipation, a lot of fecal loading. And if you were to manage the bowels better, you might see that your bladder functional capacity, or the amount of urine that could be stored, might improve in and of itself. So it is very complex. It is something that requires a little bit of, testing and maybe some discussion. So it's not an easy thing to answer for, a generalized sort of question like that. But hopefully I've given some, detail to be able to take back, to be able to, those are the very common things that we're looking at in terms of that.
Thank you so much for that.
You're welcome.
Then a last question is, potty training a toddler who's also being capped. I'm assuming this is about bowel management. There is a really detailed bowel management protocol on SBA's website that speaks to potty training. And I wish anybody who's interested in that aspect of a child's life to take a look at it. So it's the Lifespan Bowel Management Protocol, and it's on the Spina Bifida Association website.
That's great.
So experts, any last comments? You, the experts.
I don't
Uh,
believe so. I think we covered a wide range of things tonight. Andy,
Yeah.
or Shannon, do you have anything?
No, hopefully this was somewhat helpful, and if you do have questions, I'm happy to share my contact info if it relates to adulting or adult transition type things. I'm happy to be a resource for anybody in the future. But thank you.
Gianna just put the bowel management protocol in the chat, just for people if they want to see that. I don't have anything else to add, Judy, but I do want to thank people for staying up late with us and being part of this, because you know, it's always fun to be a part of these things, and hopefully we've given some good information. But please see those resources from the SBA that are in the chat, because they're really, really.
And thank you, Andy and Shannon and Julia. And just reminding everybody that self-management is a highest priority for our community. We know that from talking to our community. So we'll continue to provide as much input and suggestions as possible as we go forward. Reach out to us to the National Resource Center with any questions that you may have. So anyway, don't forget to do your evaluation when you receive it. Thank you and good night.
Thank you,
Right.
everybody.
Thank you.
Hey, are we still recording? Are we still on, or are we? Why are you laughing?
I had a question. Can
Oh,
we email regarding the recording? We missed the first 20 minutes of the presentation. I wasn't sure if we can email the email address to get the recording.
If you registered, you will get the recording sent to your email after we get it and we edit it and everything. But if you keep an eye out on our YouTube channel, they'll also be uploaded there. And if you subscribe, I'm pretty sure you get a notification as soon as we upload a new video. So, but you will get emailed one.
Okay, perfect. Thank you so much.
Thank you, guys.
cool. Thanks, guys.
Thanks. Bye.
Thanks, guys.